Nigeria ranks among the top 50 countries badly affected by the coronavirus pandemic, but 6 months after its index case was recorded in February, it is not easy to determine whether the virus is being defeated. The government says the worst might be over as Lagos, the epicenter, has reached its peak, and efforts are on to flatten the curve, but health workers across the country are facing the heat. Sarah Yeku takes a look at how Nigeria has battled the pandemic in the last 6 months.
This is a story that could well be seen from the experiences of two of the nation's most powerful cities. One from its business capital and the epicenter of the virus, the other from its political capital, Abuja. Niniola Williams is the managing director of Drasa Health Plus, a public health organization working with the government, health workers, local and international partners to strengthen health security. Niniola has been on the front lines as a trainer of health experts for about 5 years. She's supporting the COVID-19 response teams in Lagos. Even before the pandemic, a team has had to battle variations of infectious diseases, from Lassa fever to Ebola in 2014, none of which she came down until the novel coronavirus came.
My illness was mild. I had diarrhea, a very bad headache, exhaustion. I mean, the fatigue was like, I've never been so tired in my life. It felt like even just to move my hands, my arms, my legs, moving my body was difficult. I know that it's a very difficult thing for most people who have it. The fear is almost worse than the actual illness itself. It can make you very discouraged, feel very alone, feel very isolated.
Olubumi Lawan has been a health worker for more than 20 years. During the period, she worked in both the public and private sectors, engaging rural communities and public health policies in Abuja. But the coronavirus changed that story a little bit.
I cannot really say who actually I got the virus from. What I'm sure is during the up and down of the work that I do.
Although the World Health Organization says health workers across the continent have been significantly affected by COVID-19, many countries around the world still struggle to provide enough protective gear for health workers. Health workers in Nigeria say they are stigmatized, temporarily separated from their families, and in need of psychotherapy.
We have our colleagues in most of the secondary or the tertiary facility who are really taking care of COVID positive patients, but they are not being paid the remuneration or the promises by the government. We have nurses, midwives who have died of COVID-19. We have doctors who have died of COVID-19. I was on admission for 2 weeks, and I've seen a scenario where a patient on the bed, a COVID-19 patient on the bed went into crisis and could not be resuscitated. And at the end of the day, the patient died. And yet the healthcare professionals are there. But there's no PPE to wear.
Since February 27, 2020, the Nigerian government has had a Herculean task getting people to believe that there is COVID-19 in the country. In 1 month of its index case in an Italian businessman, the country had 97 confirmed cases with 1 death. By the 27th of April, 1,337 cases were recorded. In spite of a 4-month lockdown, the cases increased to 24,077, with 558 persons dying from COVID-19. August 27, 53,317 cases, with 1,011 deaths. But troubling is the number of deaths in some states in Nigeria. Lagos, which is the epicenter of the virus, has recorded over 200 deaths, with Edo surprisingly coming next on the chart, recording 100 deaths, ahead of Kano, where a wave of deaths at the peak of the community spread phase was declared not to have been caused by the virus, meaning only 54 people died there. The NCDC says men are more susceptible to getting the virus than women. From the confirmed cases, men take up to 64%, while females have 36%. The most affected age group is the 31 to 40 years of age. The data, however, shows more deaths among 61 to 70 years, though the lowest rate in confirmed cases. Today, the country is slowly nearing the 60,000 mark. with Lagos, Nigeria's commercial nerve center, leading the pack with more than 18,000 cases. But the Presidential Task Force on COVID-19 says Nigeria is not doing so bad with its fight against the pandemic.
Lagos has passed its peak, but we call for vigilance and cautious optimism because the scourge is not over yet.
Many believe the extent of the virus is not yet known in Nigeria, as the country is yet to test half of its population. Although its testing capacity increased over the months, the country has only been able to test close to 400,000 people, compared to an estimated population of 200 million.
My concerns are actually more around the sustainability of our response. While it's good to be responding to COVID now as the current threat, we know there will be other ones that will come. And so what my concern is, how are we responding to COVID and protecting and saving lives now, but also building the capacity of our system to be able to do this better and improve and learn from the lessons that we're going through now for the next time.
According to new projections by the Institute of Health Metrics and Evaluation, if social distance mandates continue to ease, the number of deaths by the 1st of December could rise to 1,724. Sarah Ayeku, TVC News, Lagos.